So, good afternoon, everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on a new topic, that is screening methods of antihypertensive drugs. So, coming to introduction, the majority of cases of essential hypertension involve no obvious causative factor, and the major physiological mechanisms that control arterial blood pressure are sympathetic nervous system, renin-angiotensin-aldosterone system, and tonically active endothelium derived autocoids, that is NO and nitroxide and endothelin 1. So, coming to the types of screening methods, one is in vitro models, and the examples are endothelin receptor antagonism in porcine isolated hearts. Another is monocrotaline induced pulmonary hypertension. And in case of in vivo models, in case of rat models, there are lots of procedures, that is renovascular induced hypertension and neurogenic induced hypertension, diet induced, then endocrine induced and genetically induced methods. So, and in case of dog model of hypertension, there are chronic renal hypertension, neurogenic hypertension. And in case of monkey model of hypertension, there is renin inhibition in monkeys. And in case of transgenic model of hypertension, there is transgenic rats overexpressing the mouse REN2 gene. So, what is endothelin receptor antagonism in porcine isolated hearts? So, potent long-lasting contractions of isolated blood vessel strips and increased blood pressure in vivo by endothelin receptor. And the procedure is that porcine heart left anterior descending coronary arteries are isolated, then endothelium denuded arteries are cut into spiral strips, that is 10 mm long and 1 mm wide. Then each strip is suspended in an organ bath, that is Krebs Hanslet solution bubbled with 95% oxygen O2 oblique 5% CO2 carbon dioxide at 37 degrees Celsius. Then the reference contraction is isometrically obtained with 50 millimolar KCl, potassium chloride. Then 20 minutes before the addition of ET1, that is endothelin 1, the endothelin receptor antagonist oblique drug added to organ bath and concentration response curve is recorded. Then another method, that is monocrotaline induced pulmonary hypertension. Monocrotaline, a pyroligidine alkaloids derived from Crotalaria spectabilis. So in this case, we are using the Sprague-Dawley rats. The Sprague-Dawley rats, 200 to 225 gram of either sex are selected, and animals are then paired with test drug for 1 week prior to subcutaneous injection of monocrotaline 100 mg per kg. Then animals are sacrificed for 7-14 days later, and their hearts and lungs are excised. Then left ventricle and lung are weighed along with main extra intrapulmonary artery are isolated. Then after 1 hour, arteries are made to contract with KCl, potassium chloride. Then contractions are recorded using liver transducer. Maximum force generated by an artery is plotted as an applied force and recorded as a polygraph. Then contraction and relaxation of agonist responses of artery are assessed. Then cumulative concentration response of KCl, potassium chloride, angiotensin 2, epinephrine are plotted. To compare the difference in mean response, t-test is applied. So this is a method of test. Then another is rat models of hypertension. In case of rat models of hypertension, there is one renovascular hypertension oblique Gold-Balt hypertension. So Sprague-Dawley rats 300 gram are anesthetized with hexobarbital sodium 100 mg per kg IP, that is intraperitoneal. Then cannulate the trachea for respiration and the jugular vein for test compound administration, A transducer is connected to the carotid artery for recording the pressure, and then a PVC polyvinyl chloride coated clip is placed in the left hilum of the kidney by fixing with the back muscle for 3.5 to 4 hours. Then pentolinium is administered for ganglionic blockade. Then release the clip and record the rise in blood pressure. Administer the test drug through IV intravenous and monitor the blood pressure continuously. Then increase in BP blood pressure after releasing the clip and reduction after the drug administration is determined. Then compare using percentage values. So this is another method in rat models. Then another model is chronic renal hypertension in rats. That is one kidney, one cliff method. So Sprague-Dawley rats 200 to 300 gram are anesthetized with phenobarbital sodium 100 mg per kg IP intraperitoneal. A flank parallel incision is made in the left lumbar area. Renal artery ID dissected, the normal dissected and cleaned, and U-shaped silver clip ID slipped around the near the aorta. The internal gap between the clip is adjusted to 0.25 to 0.38 nm. Then the right kidney is removed after tying up the renal pedicel. Then after 4 to 5 weeks, the blood pressure BP is measured, and the animals are divided into groups of different doses. Then test drug is administered for 3 days. Then pressure before and after the drug administration 3 minutes are recorded, and percentage reduction in pressure is calculated and compare the standard deviation. Then coming to another method, that is chronic renal hypertension in rats, that is 2 kidney 2 clip method. And Sprague-Dawley rats 300 mg are anesthetized, trachea, carotid artery, jugular vein are cannulated, renal arteries are located, U-shaped silver clip is slipped around them or near the aorta. Either renal artery oblique aorta is occluded using renal arterial clips. Then test compound are administered by IV intravenous route via the jugular vein. Then blood pressure monitored continuously. Percent reduction in BP blood pressure values under drug treatment is calculated as compared to pre-treatment values. Then another method is neurogenic hypertension. It is defined as a permanent increase in BP blood pressure resulting from primarily neural change. The control of blood pressure originates from baroreceptors located in the carotid sinus and aortic arch. Denervation of sino-aortic baroreceptors (SAD) is the neurogenic model of hypertension most often used. Male oyster rats 250 to 300 gram are anesthetized with halothane. Then carotid artery is cannulated for monitoring of blood pressure BP. Trachea cannulated and connected to ventilator. Jugular cannulated for administration of drug. Then pithing is done by inserting a steel rod through the orbit and foramen magnum down the whole length of the spinal canal. Then after 30 minutes pithing, 0.3 ml blood sample is withdrawn and analyzed for partial O2, PO2, PCO2, pH and bicarbonate concentration. Then carotid artery BP blood pressure and cardiac frequency is recorded. To measure alpha 1 and alpha 2 antagonism, fast dose response curves are registered with phenylephrine. Then another method is dietary hypertension, that is fructose induced hypertension in rats. Oyster rats 200 to 250 gram are housed per cage on a 12-hour light and dark cycle and fed water and chow diets, and drinking water consists of 10% fructose solution. Fluid food intake and body weight of each rat is measured every week. Systolic blood pressure and pulse rate are measured. Blood samples are collected before and every second week. During treatment, and plasma glucose, insulin, TG, triglycerides are measured. Then another method is genetic hypertension. Spontaneously hypertensive rats, SHR. This strain was developed by meticulous genetic inbreeding of oyster male rat with spontaneously occurring hypertension with a female having slight high BP blood pressure, and hypertension in this rat is hereditary and genetically determined. Then complication of hypertension like cardiac hypertrophy and cellular ionic transport abnormality occur. And then coming to dog models of hypertension. Chronic renal hypertension. Dogs 8 to 12 kg are anesthetized IV intravenous with 15 mg per kg thiopentol. Midline abdominal incision is made, one kidney is exposed and wrapped with cellophane and replaced. Contralateral kidney is exposed and kidney is removed. Abdomen is closed and sutured back. After 6 weeks of surgery, BP blood pressure is measured. Then drugs are administered for 5 days. On day 1, every 2 hours just before 2 and 4 hours after oral treatment. On day 3, 5 and 5 blood pressure recorded before 2 and 4 hours after during treatment. Then coming to the monkey model of hypertension, marmosets, clathrix, jacos of 300 to 400 gram are fed pellet diet with fruits. Animals are anesthetized 2 days prior to experiment. Catheters are implanted. Then lateral tail vein cannulated for drug administration. Furosemide 5 mg per kg injected IV intravenous 30 minutes before experiment. Animals are sedated with diazepam 0.3 mg per kg IP intraperitoneal during experiment. Blood pressure recorded continuously. Then test compound are injected IV intravenous. BP blood pressure is recorded after 30 minutes of IV intravenous infusion. So that's all are the methods of screening of antihypertensive drugs. So you can go through different articles, books, and guidelines to learn more about these type of topics. And these tests should be done according to after ethics approval, and there should be uh, no cruelty on the animals. So it should be done according to the ethics approval. After ethics approval, this test can be done. But nowadays, lots of computer-based tests are coming, so that the use of animals can be restricted, can be reduced in these kind of tests. In case of drug discovery, and also different simulation tests are also available for drug discovery nowadays. So we should be we have to be sympathetic for the animals, and we should reduce the use of animals in these tests. So that's all for today, and we will meet on another day about another topics. So please listen, watch, and share this video, so that lots of people should be know about these different topics. So thank you very much. Jai Jagannath.